Hello, everybody, and welcome to this edition of the Youth Veterinarian Initiative. I am so pleased to introduce our guest, Dr. Tania Otero, who is, well, you're in Florida, right? But you're traveling. Well, you're traveling in Florida.
That's right, I am.
Okay. So she has a hotel room behind her, so that's not her regular place of work. So Dr. Otero received her Bachelor's of Science and Master's at Rutgers University in New Jersey, after which time she received her veterinary degree at the Royal Veterinary College at the University of London. That's all the way across the pond. Upon graduating, she came back to the US and practiced in a busy multi-doctor practice for 15 years before joining Hill's Pet Nutrition in 2016 as a professional consulting veterinarian. She is currently involved with educating local veterinarians and their support staff, as well as veterinary students in therapeutic nutrition. In her spare time, she ministers at her local church and she enjoys spending time with her two dogs. And the other thing I must say about Dr. Tania Otero is that she grew up in the Bronx. And so she is thrilled to be with us today. So Madina, I'm going to invite you to come off mute and introduce yourself to Dr. Otero, and then we'll get started with our interview. Okay, we've got some feedback. Danielle, are you there? Can you figure out why that's happening?
It might be having to relocate to a little corner in the classroom away from all the other computers.
All right. Okay.
Well, in the meantime, while she's doing that, we're really happy to have the entire class on from Danielle Corbin's science class here in the Bronx. It's so exciting.
And Tania, last time we were on with the South Bronx Early College Academy, we had a sort of like a graduation ceremony. Everybody got a certificate for work that they did with the microscope during their class. And they're going to receive merit badges for that work. So,
wow.
Yeah, so we're really, really excited just to have this partnership with Danielle and this school. And they're doing so many wonderful things. So are we ready now? Are we ready? Madina, you're at Danielle's computer now. So hopefully it'll work. Okay.
This is what all of our kids are going to receive. You guys, are you excited?
Oh my goodness, that's beautiful.
Yeah.
It's got the little microscope on it. It's so exciting. You can put it on your jean jackets. You can put it on your wherever. So it's on its way.
It's pretty cool. Sew them onto your backpacks and just show it off.
Yeah.
Yep. Very awesome. Cool. Okay. Are we ready to start?
Yep. Where are they? Where's the question? Oh. All right. So my name is Madina Sissoko, and I'm a student here at Sissiko who is going to be interviewing Dr. Wells.
Not Dr. Wells, Dr. Otero.
Oh, Dr. Otero. Okay. All right. So here's the first question. What are you most passionate about in your profession?
So I love that question. It was literally my favorite one on that entire list because I think it's so rare that we actually get to express our passion, right? We end up getting so busy in our everyday and just our lives that kind of come at us, but we rarely get to display our passion. And I think if you meet any veterinarian, the one thing that you'll get to know is that we are so passionate about what we do. We don't do this for the money. We don't do this for the praise. We literally do this because we love animals. But even beyond loving animals, we love the people that bring in the animals, right? And so I think part of what makes us so passionate is the fact that we can create this bond with our owners. We can create this bond within the families, and we get to be such an important part as to why that pet stays healthy for as long as we can possibly make it. So we do our work every day. We work very hard, very diligently, sometimes very long extended hours, right, Monique?
Right.
We can attest to that. And we do that just simply out of the love that we have in our hearts for what we do. You know, there's a saying out there that says, if you love what you do, you won't work a day in your life. And I genuinely believe that, because although I work very, very hard at my job, because I love it, I feel like I'm so fulfilled every single day. It makes me work harder every day. And also it makes me want to always be better. So I want to try to be better than I was yesterday. And so I work really hard at being able to do that, knowing that everything that I'm working towards is to make the life of those animals as great as possible. So I love that question.
That's lovely. All right, here's the second question. What are your biggest challenges you have faced in your career?
Oh, the biggest challenges facing my career. Monique, I feel like I shared maybe some of this testimony with you, and I'll share it with you guys as students. So my understanding is that you guys are also in the Bronx. Is that right?
Yes.
Okay. So let me share a little bit of my story. I am of Puerto Rican descent. I am the first generation Puerto Rican, which means that my parents were all born in Puerto Rico, and then they came to the States after they were married, and that's when they had me here in the United States and actually in the Bronx. So then I grew up in the Bronx. Dominican, hi Diego, there you go, I see you. And so living in the Bronx, I felt like I was surrounded by the same culture. So all the same people, they were like me, they looked like me, their hair was like me, their color was like me. But then when I was about 8 or 9 years old, my parents moved us out of the Bronx and into New Jersey. And once we moved into New Jersey, I was the only one that looked like me. I was the only one with brown hair. I was the only one with brown skin. And I really felt like I didn't fit in. But I also knew that I had been called to become a veterinarian. This was a passion that was in my heart. It was a passion that I really strived for. I loved the sciences and I loved math. But if we can think about this, imagine for just a moment when I was your age, right? I know that's like a really big stretch to think about when Dr. Otero was that much younger. Madina, you don't have to shake your head quite so hard. Let's pretend that I'm younger than what we think I am. But back then, it was a real struggle when I moved into New Jersey, being the only one who looked like I did, to have anybody to support me. So back in those days, it was very odd for a female, a girl, to actually go into the sciences. It was very odd for a Hispanic like myself to go into the sciences. And so everybody discouraged me from going forward. And it was such a discouragement that even my academic advisors told me that maybe that was not the best career choice for me to choose. And they were trying to point me in the direction of something closer towards like home economics. And I had to really fight for what I thought I wanted, what I knew I would be good at. And so I think for me, one of the biggest challenges was learning how to come against adversity. Because one thing that you're going to learn is that life can be a real challenge, and there's going to be lots of stumbles and blocks that get in your way. But when you're passionate about something and you know that you're good at something and it's something that you really want to do, then go for it with all of your might, no matter what people tell you that you can't do, because the world will always try to disqualify you. But when you have a passion that's been birthed inside of your belly, then you get to go for it with all that you have and be the best at it that you can be, so that you can then go back and say, I did it. Despite what everybody said I couldn't do, I still did it. And not only did I do it, but I'm great at it. Because now I get to be here as an example for all of you that I'm so proud of, that you're working so hard towards these goals, and you can do it too. So if I was able to come against all of these different stumbling blocks, I have no doubt that each of you can also go on to be amazing scientists, amazing veterinarians. And even today, I still look at the graduating classes. So Monique mentioned that I'm traveling. I'm actually up in Gainesville, Florida today. And I'm here because I'm at the University of Florida, and I'm going to be giving a lecture to about 50 veterinarians tonight, and then about 200 veterinarians tomorrow. So here I am, a female, a girl with curly hair, with brown skin, and I'm going to be lecturing to a room full of veterinarians that don't look a whole lot like me, because I worked past all of those stumbling blocks to be able to get where I am today. So if I had something to say to you, is don't be discouraged and continue to push forward.
Yes.
Okay. The hardest things bring us where we are. All right, third question. Would you be willing to work in a veterinary emergency?
Would I be willing to work in veterinary emergency? Is that what you said, Madina?
Yes.
So the answer is yes. I've done it in the past. Part of my biography that Monique, Dr. Wells actually shared with everyone was that it was a multi-doctor, really busy practice. And so we did run emergencies quite a bit. And so not only did I see regular cases, regular patients every single day, but I also ran our emergency room and our ICU room. And so that's something that I was very passionate about, but I still am very passionate. So even though my career path has taken me out of the hospital setting and more into a consulting setting, one of the big passions that I have is the company that I work for is we actually go and we put forth a lot of effort into our disaster relief program. And the reason for that is because we really believe that in the midst of disasters, somebody has to be willing to stand up and actually be the voice for these pets that are suffering in emergency situations. And so I believe that I'm their voice. And so if it's me going into the midst of an emergency to be able to put a bandage on a dog, be able to provide them with a bowl of food, be able to dry them off or get the oil off of their skin when they've gone through these oil disasters, then I believe that that's what I've been put on this place to do, to be able to do. So emergencies to me are so crucial because we really get to put our stamp on there really quickly and then allow them to go on and live where they were supposed to.
Okay, before we go further, Madina, are you sitting close to anyone? Okay, good. No. Because I just wanted to ask so that we have you on camera, I want to see your face just for 1 second. Can you just take your mask down and we see you? Or is that not allowed?
No, that's fine. Yay.
There we go.
Thank you.
How do you care for an animal that is afraid or stressed?
How do you care for an animal that's afraid or stressed? So interestingly enough, about, let me think, about 8 years ago, I was certified in what's called fear-free handling. And the mission of fear-free handling is to ensure that when those animals that are coming into your hospital that might be a little bit more anxious, they might be acting in an aggressive fashion because they're so nervous, what can we do to be able to manage that visit, to make them as calm as possible, but also to make sure that they have a good experience. Because the one thing we remember about animals is they've got really good memory. And so if they've had a bad experience once, they're going to continually have a bad experience. Whereas if I can step in and actually make this and create an environment that's more comforting for them, then that's really what I strive to do. And so when I'm looking at those stressed or anxious animals, it starts before the visit. It can't happen at the visit itself because they've wound up already with that stress and their anxiety. So there are some things that I might do at home that I'll have the owner start instituting before they come into my practice. And so what might that include? Well, I might actually give them like a pheromone spray that they can spray down the carrier, or they could spray down a blanket. So they're already starting to create an environment of calm. But then I might also give them some calming agents, and those can be very natural sources that really help their brain to just kind of relax a little bit, almost like you and I taking a chamomile tea before bedtime. and just sort of relaxing us a little. If those don't seem to work, then I might work with the owner about either doing a home visit. So I'm not necessarily bringing that pet into the hospital, which can be a very anxious type of a situation. Or I might work with them in the car. So again, I can try to create an area that is comforting for that pet. But if it's an absolute must that they have to come into my hospital, so maybe we need to do some x-rays or they've got to come in for surgery and they're still very, very anxious, then there are some medications that I can administer that actually help to relax them and make it a much less stressful environment for them. So I will never say no. I've never had to say no to any animal coming into my practice. I've heard of veterinarians doing that, but I've never had to say no because I work beforehand to get them to the point where they can be really nice and relaxed and make this a calming visit for them.
And Dr. Otero, can you tell us what a pheromone is? You talked about pheromone spray.
Monique, thank you so much for telling me that. There's sometimes we use words and I forget that they're not common words. And so thank you. So a pheromone means so even us as people, we release these scents, these like hormones that are going on inside of our bodies that we are familiar with and that we can sometimes be attracted to or even repelled from. And so a pheromone are those hormones that are released by that animal, either a cat or a dog, that serve as a calming agent. So the ones that I use are going to mimic the smell of their mom when they were nursing as either puppies or kittens. So it actually brings them back to a place where they were really, really happy because they remember just being with their mom when they were nursing. So they had big full bellies and it just helps to relax them.
Okay, great.
Thank you. Thank you, Monique. I totally forgot about those words.
I do it too.
Yep.
Okay, next question.
Question 5. What if an animal is sick and needs urgent help, attention, but its owner cannot afford to pay?
That's a really good question because we see this every single day, right? This is not a rare occurrence. And it's something that if I had to be honest, veterinary school does not prepare you for these conversations. And so this is where you get real life world examples and you have to work through it. So let's go back to before they get into that situation. Whenever I have an owner that's coming in for their first visit, I actually educate them about how much it's going to cost to be able to maintain their pet's health. And then also, how do we prepare for emergencies? So I think this is all about planning. Just like when you have children, you want to plan with their health insurance. I talk to my owners about having pet insurance for their pets, depending on what level of care we're looking at. So, and that's going to depend on the type of breed that we're dealing with, what the owner's money concerns might actually be. So I very much talk to them about pet insurance beforehand. And then I talk to them about creating an emergency savings plan for their pets. So every single month, I might have that owner putting away a few dollars in the bank that they don't touch, that's just for their pet. In case of emergency, they're able to already be pre-planned for when that will happen. But let's say that emergency comes in, the owner has not come to see me, so they haven't pre-planned for emergencies that are coming in. We will talk about exactly what type of coverage we're looking for. So what are we trying to achieve in that emergency? So I will usually try to offer them different levels of care. So there are things that we can try that may not be the topmost that we're looking for. And then I'll offer them the topmost care and see what works best for them. If we're still in an area where they may not be able to afford the care that we're looking for, then I will either consider something that's called care credit or some other type of a financing solution where they can apply for assistance. We will talk about things like post-dated checks, where they might actually write me a check, but it's not dated for another 2 or 4 weeks. So we can actually spread out some of the payments as well. And then if they're not able to do either of those, then oftentimes I do work with rescue organizations that also can provide emergency assistance that we can help those pets for. Now, let me put a little star on there, a little asterisk. Now, that does depend on what we're treating. If we're treating a disease that we feel we can actually maintain or cure, then that's the route that we would go. But if this is an emergency disease that pet has a very poor prognosis or not a good likelihood of making it, then we might actually be talking about humane euthanasia, which means putting this animal to sleep so that it doesn't actually have to suffer any longer. And that's a tough conversation to have, especially amongst young aspiring veterinarians, but that's the reality of veterinary medicine. And so we have to be able to prepare our owners for those situations. And it's our job to be honest with them and portray to them exactly what we think is the best care for that animal.
Question 6. How do you inform the family that their pet has a serious disease?
So how do I inform my owners that their pet has a serious disease? Boy, this all comes down to communication. And unfortunately, another area where we did not learn a whole lot in veterinary medicine in school. So you have to sort of learn this on your own. Really fun fact, I became a communication specialist last year. So this is an area that is really, I'm very passionate about, because I think we can make or break our relationships just by good or poor communication. And so talking to my owners about something that is really serious that their pet is going through requires me to communicate effectively with them. And so what do I mean by effective communication? Everyone thinks communication means talking and talking and talking, but sometimes communication means listening. And so sometimes we have to sit back and listen to what those owners are going through. And one of the best ways that I like to do that is I want to put myself in my owner's shoes. So if I was the owner of that pet, how would I want my news delivered to me? And how can I express the same compassion and empathy that I want my owners to be able to receive? So I always will put myself in my owner's shoes. But the one thing I will not do is I won't dilute the facts. If I'm dealing with a very serious disease, it's my job and my responsibility to communicate that with my owners as openly and honestly, and help walk with them through that conversation so that they don't feel like they're completely by themselves with making a choice. I'm there with them to guide them, to lead them, and I'm there every step of the way. So 1 is to be honest with them. 2 is to sit back and listen to what their concerns are. And 3 is to just be present, be with them from start to finish. And that gives you the most respect that an owner can look for.
That's just like a doctor dealing with even human patients. I mean, because people can care just as much about their animals. It could be just like their child. So you've got to be careful in how you deal with them.
Mm-hmm. So true, Sharita, so true.
Question 7. In which animals or pathology have you specialized?
Oh, that's a good one. So it's sort of changed, right? So let me be very transparent, Monique, this one hurts me. I've been out of vet school now for 20 years.
Oh.
I know. I feel like I just graduated last year, but so this actually shifted, right? I think we change as we get older, for sure. So when I first graduated, I was very interested in critical care. And so that goes back to my emergency and my ICU training. And so the area that I had the most interest in was especially transfusion medicine. So learning and teaching my staff how to do things like blood transfusions. That has since shifted over the past 10 years, I would say. And now my focus is on nutrition. And so how can I feed my pets to be at their healthiest level? How can I transform their lives so that they might be in a disease category, but if I can feed them the right food, I can actually get their disease to be under control and manage them, and sometimes even cure them, just simply by allowing them to be on the right amount of food, the right type of food, including the right type of ingredients inside of that food, and educating my owners on how they should be fed. Sharita and I were having a conversation about the obesity epidemic that's happening in our pets these days. And that's all due to lack of communication on the veterinarian side, on teaching the owners on how those pets should actually be fed. And so that sort of has shifted as I've aged. So now nutrition is my biggest focus. It is what I am extremely passionate about these days, and is actually what I'm lecturing on over the next 2 days.
Okay, So that has concluded our interview. You've been a great interviewee, and I hope to ask you more questions.
Absolutely. Well, I'm here, and if there's anyone else that has any questions, let me know. We're happy to answer those right now.
Yes, for sure. I think
Well,
Sharita has to jump off, but we're going to continue.
sorry.
If people have questions, we can take them. Go ahead.
There was just a couple of pictures that you sent us, and one was the one with you as a little girl. Monique, can I share my screen?
Share it, please.
You should be able to.
I don't remember which one it is, Sharita, so hopefully it's okay.
Oh, I thought you sent it to us for us to show it. Is that not?
No, that's totally fine. I just forgot it was so long ago. I told you, I'm like 20 years out. I'm an old lady now.
Can you share?
Yeah, it's such a great one. Let me see. Yeah. Let's see. I thought the kids would love seeing it.
Oh, please. I love it. Oh, oh my goodness. That is so okay. So this is me on the right-hand side. And on the left-hand side is my big sister. Okay. That was us on a street corner in the Bronx as we were waiting to go to school. You could see those were what the backpacks used to look like in the day. My sister, I
know. They weren't on the back. You had to they had a handle.
They had a handle. And we laugh at this picture now because my sister has always been very focused, and I've always been the dreamer. And that picture very much shows me sort of dreaming out into the distance.
Yeah. And then also you sent us this one.
Oh,
who is this?
So I live in Florida now, and I am a complete beach goer. I love going to the beach. This is my pit bull. Her name is Ninja. The kids named her after the Lego pieces Ninjago. And so sometimes we'll call her by her full name Ninjago, but usually we just call her Ninja. Mm-hmm. She is now 11 years old. She does battle some stomach issues, so she's on a very specific food for that. And she's part of the reason of what drove my passion to nutrition these days. So that's my Ninja.
Okay.
Yep.
Okay.
Is there another picture? Do I put on there?
Let's see. I think that was the only ones that I brought over.
Okay.
Yeah.
Okay. So. I also have another dog. She's a Havanese poodle, and she is 17 years old.
Oh my God.
So talk about the effects of nutrition, of keeping you alive as long as possible, as healthy as possible. She is my living testimony that nutrition works to keep you healthy.
Wow.
Yeah.
Oh.
Fantastic.
Well, I know that, and Monique, I was saying if it went over an hour, because I've got to get off at 3:30.
Okay.
Or 4:30.
Okay.
Part of Danielle's class, they are from out of the U.S. and like the Dominican, and where are some of the other places? And I thought that maybe they could relate to you being from Puerto Rico.
Yes, I saw Diego that you said you're from the Dominican as well, right? I love it. Wonderful. Excellent. Yeah. It's tough. It's hard. Being Puerto Rican for me was a real challenge back when I was coming of age, because we were the minority, and I was now a minority in a non-minority city. And being the only one, I had to work that much harder to get to where I am. But you can do it. Don't let people discourage you. Don't let them discount you just because of the color of your skin, your ethnicity, your background. You are every bit as qualified as the next person. You just have to work hard at it.
That's right. That's what this is all about. This is what YVI is all about. Having people like you, Tania, share your stories, and just to show that you can do it, because here's somebody who has done it, and here's somebody who you can reach out to if you want to do it and talk about various things, even in more details than what we're talking about on this episode and in other episodes that we have. So do we have any other questions from anybody else in the class? Does anybody else want to ask a question? No.
Okay. So how many of you want to become a veterinarian? A couple?
Thinking about it.
Thinking about it, yeah. It's possible. I'll tell you, there's nothing else I'd rather do or be. It is the best job that I could ever have hoped for.
I agree. It's the same for me. I see some grown people in the background.
You know, they've been so involved all year in just the sciences. Like they've investigated owl pellets, they dissected a frog. So they're
a gelatin frog.
A gelatin frog. They're getting very diverse experience, especially for their age.
I love it. I love it. Yeah, that's great. I mean, we've had to, well, I was a little bit older, but we did a frog, we did a shark even, as part of our classes. Yeah, it was pretty neat. Learned a lot. Wow. Sciences are fun. I love the sciences and discovering all that's out there and all of the creations that have been made for us to be able to investigate. It's awesome.
And tell us about your reading, because we're going to start a book club for YVI. And reading is so important. It's important just, you know, from the standpoint of if you're going to go to vet school, you have to do a lot of reading, lot of reading. And you have to do a lot of reading to get into vet school. So can you tell us about how you read as a child and what kinds of things you like to read?
Yeah, so interesting. So this is like a safe space, right? We're young and we're learning. And I'll tell you guys this honestly, because I'm sure this is going through your mind when you hear Dr. Wells saying there's a lot of reading. I hated reading when I was a kid. When I was probably about 7 or 8 is maybe when I started to maybe spike a little bit of interest, but it wasn't until I was closer to about 11 or 12 when I really started reading, because I really hated it. But I realized that it's because I was being forced to read things that I really didn't enjoy. And so then once I started to discover things like science fiction books, that's really when it started to really pique my interest. My favorite book is The Lord of the Rings. Loved the books. Once I actually saw it became movies, I got even more excited. And then now I read more. Well, I have a second job. I'm also a full-time pastor, as I think Monique, you know. So now I read more spiritual books, but the reading process never ends. And so even though you finish with school, you're constantly developing who you are. You're constantly striving to become better. You're constantly striving for more knowledge. And now it's not forced upon you, but you actually want to do it. And so you try to intentionally find free time to be able to read books and actually continually read books. So I find it really funny, but also really interesting how I started out in life really hating to read. And now I try to intentionally find moments to read as much as possible. So it's a journey.
That is so wonderful. How many people on this call like to read? Raise your hand. Oh, there's a few.
Oh, good.
That's great. Yeah. Yeah. Oh, this is wonderful.
We see you, sticker girls.
That is really wonderful, because certainly when you love to do something, it makes it that much easier.
That's true.
And when you love to do something and you find like a book that's like hard for you, still it's like, okay, but so I love reading. So this is going to be, I'm just going to make that extra effort because I really want to do this. And so you're definitely ahead of the game. That's just so wonderful. And I'm so excited that you're going to have YVI books. This is going to be great. Do we have, does anybody want to talk about books that they like to read? Would you share with Dr. Otero what kind of books you like to read? Pedro.
Yeah, Pedro. Yeah.
The books that I like to read are comic books.
Ooh, fun.
Comic books, okay. Did I see Edwin's hand up? Come off mute.
So the books that I like to read are soccer books.
Could you understand that?
I didn't. I apologize.
Could you say it again, Edwin?
So the books.
Maybe
There's a
in the
big
chat.
echo.
Edwin.
Can you put it in the chat? You have a big echo.
You want to type that in the chat, Edwin, and I'll see what you were saying. I apologize. I couldn't hear it.
Yeah.
It's okay. We roll with technology, right? This is who we are now.
For sure.
Yeah.
Anybody else?
Now, you know, for those that may not like to read as much, you know,
Soccer
my son, when he was in the fourth, what kind of book did he say?
Soccer.
Oh, soccer book.
Soccer books.
When my son was in the going from in the 6th grade going to the 7th grade, he got a really low grade in reading. And so over the summer, because he always read, now my boys are in their 40s now, but he always could tell me everything about all of the athletes because he collected baseball cards and basketball cards. And so what I did is I got him Sports Illustrated for Kids. And over the summer, I made him turn in a book report to me, 1 page every week about who he read about in the Sports Illustrated. When school started the next level, the next year, that was just over the summer, his reading level had gone up 3 levels.
Wow.
Just from because he started reading. So for those of you that may not like what you're reading every day for school or whatever, find what's interesting to you, just like how Edwin likes reading about soccer or whatever. And I guarantee you, your passion for reading will go up and your reading level will go up.
Your reading level will go up. Diego says he likes to read comic books also.
Very cool.
Yeah. Yeah.
I'll tell you, a friend of mine. Yes, exactly. So she really also did not like to read, but she was a great artist. She loved to be able to draw. And so she managed to bring life to the books that she was reading by simply drawing with them, and was really able to love reading once she was able to pair the two. So I think you're right, Sharita. It's about finding what you're passionate about. What do you like? And bring it to life for you. Don't give.
Yeah.
Love it.
Yeah.
Thank you for your time, but we have to go because it's time to leave.
Okay.
I appreciate for you answering the questions we decided to give you, and I hope you have a nice day.
Thank you so much for having me. Take care, guys.
Wonderful. Thank you all.
Bye.
Bye.
Bye. Bye.
Bye-bye.
Bye. Bye.
Oh, goodness. Bye, Edwin. There we go.